Friends, I hope that you all are good. Sorry, I'm late because of some technical errors. Now, this is the repeat lecture for the tomorrows who are unable to attend the tomorrow's lecture, and additionally, we are going to discuss some more manual therapies detail today in today's lectures. So first, may I know somebody please mention in the chat that am I audible and visible clearly? Somebody in the chat box, please mention that am I audible? Yeah, good afternoon, Mr. Dr. Sharma. Am I audible? Okay. Okay, thank you all. Okay, so without wasting time, let's start today's presentation. And today's topic for the lecture is the significance of the manual therapies in the multidimensional approach towards the pain. So, friends, why I always insist on the manual therapies or the multidimensional approach towards the pain, the basic and the major reason for is that uh, because the pain has a different phases. I always called it pain as a Ravan because it has a different phases, it has a different manifestations, and pain basically is not only a symptom, but it is a very tricky symptom uh, because pain is a perception and you cannot evaluate or calculate or measure a pain clinically. You just have to view the patient, you just have to understand the cause of the pain, the root cause of the pain, the origin of the pain the words by the word of the mouth from the patient only. So you have to be very vigilant, you have to be very careful while diagnosing the pain. And the today's topic is about the manual therapies. So today we are going to discuss that how manual therapies help you in both the way to diagnose the pain and also to treat the pain, because as you know that we are having five senses. In according to Ayurveda also we call it as the five gyanendriya and indriya artha जिनको कहा जाता है. These are the five indriya artha, that is eyes, nose, ear, taste, skin and smell. So basically pain is felt or the pain is expressed through your touch, is expressed through your kinesthesiology. It is called as the kinesthetic effect. So, because what happens, the patient will always tell you that I have pain in my shoulder, I have pain in my elbow, or I have pain in my knees, or I have low back pain. So the pain is specified according to the organs, because and there are also called as the dermatones to correlate the dermatones with the neurological aspect of the pain. Friends, in the last, I am going to allow you to ask the question and raise your hand. Till then, please, I request you to don't raise your hand. If you have any query or if you have any doubt during the session, you can put it into the chat box. But please don't raise your hand. It disturbs while delivering. Okay. Then coming to the let's start and let's understand the manual therapy, that what is the manual therapy and how the manual therapy will help in treating the patients. So let's understand with this presentation. Okay, so the today's topic is significance of integrative manual therapy in pain management. So Integral Indopedia Ayurveda Skularka and Ayurvachin Ayurved Gurukul is presenting this webinar to you. Myself, Dr. Swapnil Avinash Gawande, an Ayurveda consultant for pain, stress, and sport injury management. So let's see what are the manual therapies there. What is the manual therapy? So the manual therapy, the simple definition, there is no specific or a common definition for the manual therapy. But the manual therapy can be understood as the manual therapy is a clinical approach based on the skilled hands-on therapy to decrease the pain and improve the mobility of the joints, soft tissues, and the nerves. Though there is a sparsha chikitsa, which can also be considered as a manual therapy, can be used for treating different kind of things, just like hypnosis or some of the Reiki techniques or some of the other mythological and other psychological or skin related techniques. But as we are speaking about the orthopedics and as we are speaking about the pain management, we will here consider the manual therapy to improve the mobility of the joints and soft tissues and nerves. Okay, then what are the basic benefits of the manual therapies to practice manual therapies in day-to-day medical practice? So the minimum resources are required. So as per the Sushruta, our hands and fingers are also can be used as a shastras and astras. So in manual therapies, our hands and our body parts are itself a particular uh, device, a particular instrument to treat the patient. Then, as it doesn't require any particular instrument, any particular setup, any particular prerequisite, so it becomes very cost effective. And as it becomes very cost effective to the Vaidya or a doctor, it becomes cost effective to the patients also. And the maximum returns of to the Vaidyas also, because as a Vaidya did not need to invest for the medicines, or there are no recurrent, there is only one time investment is to learn that particular manual therapy. Whatever manual therapy you are learning, you become proficient in it day by day as you practice more and more on your patients. But you have to just invest only time, and one time investment, that is the learning fees for that particular manual therapy. Then most of the time the soft tissue mobilization or the soft tissue injuries which are superficial can produce the instant and long-term results by the help of manual therapies. The manual therapies, which are the manual therapies we are going to see in the upcoming part. But all the kinds of manual therapies, it might be soft tissue mobilization, might be chiropractic, might be osteopathy, might be myofascial trigger point release, might be strain counter strain release technique. There may be a facial distortion model, that is FTM technique. There are numerous techniques, manual therapies are been developed in last 30-40 years, and now more and more therapies like Ayurveda practitioners, the physiotherapists, and the naturopaths, all the alternative therapies are now going from modern mechanical tools towards the manual therapies, because manual therapies are proving more and more cost effective and also result oriented, and have that humanization, that human touch in the treatment. So, which are the common manual therapies? The common manual therapies are the Marma chikitsa, the Snehan, Mardan, osteopathy, chiropractic, trigger point therapy, and myofascial release. We will go into the deep to understand that how these all the manual therapies work. Here, Marma chikitsa, all you know. Here is Marma Chikitsa. All you know that the Marma Chikitsa are the 108 Marma points which are being explained by the Sushruta. There are some of the other types of Marmas also, like Adangal Marma are there, Agasthyar Marma are there, Parshuram Kathit Marmas are there, and they have different numbers and different points and different significance, and they have their own classification. Only if we will speak about Marma, there will be only 4-5 hours of lecture only about the primary information of the Marma, because Marma is a very vast topic. But for the sake of understanding, I am just giving some of the names. I am pronouncing some of the names about that the Adangal Marma or the Adangal Marma. In that particular Adangal Marma therapy or the Adangal Marma philosophy says that if you want to treat the left side, you have to treat the right side Marmas, because they have their linkage philosophy, right that the right cerebellum and left cerebellum in the paralysis. You all know that the paralysis happens to the opposite side when the opposite part of the brain get affected. Same on that same philosophy and the same thing, Adangal Marma works. You may have listened about a special technique in the Japan. It is also a manual therapy in Japan, which is called as Kochi method. Kochi is a village in that particular Japan, and in Japan that Kochi method is being used, and in Kochi method they believe that your each and every muscle is linked to each and other muscle, and when you treat one muscle, then it will have that significance, it will have that impact on that adjoining muscle, and hence they also treat the adjoining muscle, not exactly opposite but the adjoining muscle. In Adangal Marma we treat the opposite side. Okay. Then in Agasthyar Marma also they have their own philosophy. In Parshuram Marma, in Parshuram Sanhita, which is more popular in Tamil Nadu and in Siddha stream of medicine, they have explained more than 5,000 Marmas points. So there are the differences of numbers, types, their implication, their manipulation, their mobilization. But in general graduate level or in Ayurveda point of view, particularly in which are been popularly taught and learned, are the 108 Marmas said by the Sushruta. Okay, and so I don't think that the Marma I should more elaborate, because you all are the Ayurveda graduates and you know what are the importance of the Marma and how the Marma classified. So moving next, I am going to share some of the slides about the remaining manual therapies. So which are these? We are going to see one by one. So as we are speaking that all these manual therapies are basically focused on the soft tissues. So here we are trying to understand that which are the soft tissue techniques, because in the physical therapy or in the now there is a new emerging field of medicine which is called as the functional medicine. Now functional medicine also, after MBBS there have been a course started in some of the colleges. It is called as physical medicine. Sorry, and also the uh, functional medicine is now an emerging branch of the medicine. So these all functions work on the soft tissues, because basically whatever may be the reason of the pain, might be neurological, might be any of the reason, but these are expressed through the soft tissues, the which we call that adhishthan. We can say that the adhishthan of this ruja will always be a soft tissue, always be a six dhatus except asti dhatu. Ras, Rakta, Mas, Med, Asti, except Asti, Majja and Shukra will be the adhishthan for this ruja or this vata vikara. So the first soft tissue technique which we are all practicing in our practice as a Ayurveda practitioner, that is the Snehan or the Mardhan, that is commonly said as the massage. So the systemic and therapeutic and the functional stroking and kneading of the body is called as the soft tissue. Is called as a massage, or we call it as a sneezing. So the specific kind of strokes you take, the specific kind of uh, pattern in this snehan you use help in relieving and uh, helping in the your lymphatic drainage. The lymphatic drainage is a drainage is kind of a toxin, or you can say that the accumulated viscera, or sorry, not viscera, the accumulated lymphatic storage uh, that may cause the knots or nodules, which cause the pressure on the soft tissues, pressure on the vessels, pressure on the nerves, and these can be removed very efficiently with these massage techniques or these Snehan techniques. Then there is a transverse friction massage. This can also be simply called as a deep tissue massage, or uh, it may be somewhat can be compared with the Mardan. The tissue undergoing the TFM should, whenever possible, be put on moderate pressure but not painful. So the stretch should not be painful, but the pressure should be considerably more than that of just Snehan or the Vimlapan. The exception to this rule is when applying TFM to the muscle belly, because the muscle belly has got the more myofascial tightening, the more muscle mass is there, so is usually positioned in the relaxed position. Because if you will give more push, you will exert more pressure on that particular part, then it will be more harming. It may harm the muscle tissues, muscle fibers. The length or the average time that should be done at the particular part. For example, you are doing the TFM for the hamstring, so it should not be done for more than 5 minutes. The 3 to 5 minutes is the simplest, is the advisable time period. And if it is not going to get released in 3 to 5 minutes, you should try something else. The next technique is the myofascial release. The myofascial release, those who have attended my earlier lectures may have gone through the myofascia. What is the myofascia? Myofascia is a covering of at the multiple levels from deep tissues to the superficial skin, and therefore myofascia is the fascia which is covering the muscles, and it is also divided into two parts: the deep myofascia and the superficial myofascia. So the series of techniques designed to release the restrictions in the myofascial tissue that are used to treatment of soft tissues dysfunction and has not responded to the other interventions. Because myofascial, although whatever myofascial release will definitely give some of the other results, unless and otherwise there is a obvious injury, obvious discontinuation of the muscle fibers, obvious injury or a acute injury, or there is a disintegration, or there is a tear, or there is a fracture in the muscle belly, then myofascia is going to help definitely. हो ना, तर घेऊन राहिली. आता बघा बरं, आलं का? Am I audible now?
आलं समजा.
Okay. Okay, sorry there, because of the power cut issue, it was got disturbed. We will start again. Okay, so myofascial release is going to help you at any point of history. So you have to, but for doing the myofascial release, you must have the uh, very good knowledge about the muscles, the facial distortion, the facial lining, the pattern in which the fascia got distorted, and you have to understand also the mechanism of injury in this particular. Then the soft tissue, this soft tissue technique of the myofascial release can be proved as a boon to your practice. Then also there is a augmented soft tissue mobilization technique that is also called as the instrument assisted soft tissue mobilization, that is IASTM. So in that particular tissue technique, just a minute, I will show you some of words. So these kind of um, instrument are used for the soft tissue mobilization. This is called as the bar. It is used for the large muscle bellies like thigh, hamstring, quadricep, then the back muscles, and this is also a handle or a small ISTM tool that is used for the uh, myofascial release of the small or small areas like fingers, like ankle, and the small portion where you want to release the myofascia. So this technique is called as the augmented soft tissue mobilization, or also called as the IASTM, that is instrument assisted soft tissue mobilization. In this particular ISTM, you can use to remove the scar tissues around the muscle, the tendons, myofascia. We are going to see some of the videos of this soft tissue mobilization also. Then acupressure, as you all know that there are the acupressure is a Chinese technique to which is helped by mobilizing the particular soft tissues which are present into the meridian according to the acupressure theory. That involves the application of manual pressure over the body's acupuncture points to improve the flow of body's energy, known as the Qi, that is QI. QI is the acupressure is called as a energy flow. So to correct that energy flow, acupressure is also considered as one of the soft tissue techniques. Then muscle energy techniques. The muscle energy technique is a special kind of exercise therapy. You can say that we also called as muscle energy technique exercises can be used to mobilize joints, strengthen weaken muscles, and to stretch adaptivities, shorten muscle and fascia. So it is helpful in the treating the patient with the uh, energy loss, the muscle loss in the paralytic patient, in the paralysis of different kind, or the where there is a where there is the weakness of particular joint, or post-operative rehabilitation, post-operative restricted range of motions. For example, if a patient is having the fracture at the condyle and had his total arm into the plaster cast for more than 45 days or 30 or 45 days, then after opening, or after though the muscle has got union, the bone has got union, but because of that immobility of the muscles for such a long period, they become stiff and can't be straightened or can't have the full range of motion. At that particular point, muscle energy techniques can be used very effectively to restore the range of motions, to strengthen that particular body part into the paralytic patients. Then there is also a technique called the strain counter strain or positional release that involve a gentle and simple indirect manipulative approach for the treatment of the somatic dysfunctioning using the passive positioning of the body in the position of the ease rather than in motion restriction to evoke a therapeutic effect. For example, here I can, if anybody is having a scar tissue or if anybody is having, so I will explain it after this. Joint mobilization. The joint mobilizations are of different types. Please remember, remind me after something when I will explain you the positional release or the strain counter strain technique. First of all, we'll finish this. The joint mobilization is the Kaltenborn technique is popular according to all joints mobilize. According to the Kaltenborn, all joints mobilizations, when performed correctly, should be made parallel or at the right angle to each of the plane of the motions. There are three plane of the motion, that is sagittal, axial, and coronal. So all the joints should be into the right angle into the all the plane of motion. So Kaltenborn technique use the combination of traction mobilization to reduce the pain and mobilize the hypermobile joints. If there is a laxity, if there is Ganeshla Polkar, sorry for the interruption. Sorry for the interruption. So, so this is one of the technique, Kaltenborn technique to for the joint mobilization. Also, joint mobilization techniques include a broad spectrum from the general passive motions, that is like this in the physiological canal planes, cardinal planes at any point in the joint range of the motion, to the semi-specific specific accessory that is called as the orthokinematic. So you have the knowledge of orthokinematic way. So joint glides or joint distractions initiated from the open packed position of the joint. That is, if the joint is packed, then you have to open, initiate from the facilitated, that how the patient is feeling comfortable, you have to mobilize. I will demonstrate this also. Then the next technique is the functional tissue technique or the functional technique. Functional techniques are the indirect techniques using the positional placement away from the restrictive barrier, similar to those techniques described under the strain counter strain. Joint manipulation. So joint manipulations is something like chiropractic. So unlike mobilization, which are applied singularly or repeatedly within or at the physiological range of the joint motion, uh, joint mobilization involve a thrust or a, जो आप वीडियो देखते हैं काड़ काड़ या फिर हम उंगलियां मोड़ते हैं, so then this is called as the mobilize manipulation, because the meaning of the manipulation is to change the predefined or the main to break the physiological barrier. So briefly, force beyond the restricted range of motion. Neurophysiological techniques, that is the myofascial trigger point release. Um, okay. So myofascial trigger point release, as I have said that the myofascial release is the one of the technique which is very useful. The same is the myofascial trigger point. Basically, why these myofascial trigger points? are formed into the fascia and muscles of the fascia or the fascia of the muscles, because when there is a injury, when there is a chronic overuse injury or an acute injury, the muscle fibers got distracted or uh, torn or ruptured, and after some time they got automatically healed. When they got healed, they form a scar tissue there, and that particular scar tissue, that particular nodule obstruct the flow or the range of the motion or reduce the flexibility of the particular muscle. Sorry. So the major goal of the myofascial trigger points is the relieve pain and tightness involved in the muscle, improve joint motion, improve circulation, and eliminate the perpetuating factors which I have discussed, like fibrosis, nodules, or the loss of flexibility of that particular muscle belly. When treating the patient for a specific muscle syndrome, it is important to explain the function of the involved muscles to the describe, demonstrate a few of the activities to postures that might overstress it, so that the patient can avoid such activities or the postures. Okay, that's also I am going to demonstrate you. So these are the common techniques which are involved into the manual therapy. So first of all, the um counter strain technique we are going to describe, that if there is consider that there is a pain, or here there is a point where I am having the pain, or this muscle I am uh, experiencing the disturbed range of motion or restricted range of motion. So how it will work? So I am going to check it, that is it in which direction it is elevating. Is the pain increasing while pushing up? Is down, towards left, towards right? So in the all 4 or 5 directions, when I move and the patient, and if I feel that the pain is more here when I am pushing it upward, then I will pull it down here for the 90 seconds, and will give the counter strain to this strained muscle, and it will release the stretch on that muscle and will produce the instant result, instant increase in range of motion, instant rate sorry instant release in the pain. So this is how the soft tissue works. Also, what is the difference between mobilization and manipulation is that, just for instance, consider that this is my limb and I am giving this exercise. This is the joint move. This is the joint mobilization. For example, I am having the restricted movement beyond this particular part. So if I am doing this particular movement, so this is the joint mobilization. If I am asking the patient, or if I am giving or restricting the force here and pressing from the another side, and I am restricting the affected part, then this is called, or this is how is the example of the muscle energy techniques. You have to use the different muscle energy techniques and different types of angles at different joints, but for the sake of understanding, you can understand that this is a muscle energy technique, that you have to tell the patient to push, to hold, or to restrict the force from the opposite side for 20 seconds. 1 2 3 4 5 6 7 8 9 10. 1 2 3 4 5 6 7 8 9 10. Relax. Got it? Restricted for 20 seconds. Relax. So it is going to give the more energy, it is going to give the more strength to that particular point. So this is called the muscle energy. Okay, then speaking about the myofascial trigger point. So, for example, you just understand that this is my muscle, and if I am having the particular point that this particular point is paining, this particular point is having the most severe pain, then I am going to treat it by different kind of manual therapies, like with the help of the uh, myofascial release, with the strain counter strain method, with the needling, with the dry needling, with cupping. Also we are going to see some of the examples of the cupping, because cupping is also included into the manual therapies, because we are doing it manually. Going back to the presentation, we'll see some of the examples for the practical manual therapy. So this is a video which is the one of the good example for the myofascial release. How effective is the myofascial release? As I have told you that myofascial release will definitely give you the result. So this video is a live video of an athlete who is having the pain in his particular quadricep tendon. He is having the pain on palpation. Also, he is having the restricted range of movement. After having the extra effort in the, I will mute it so that it will be more clear. So he is telling that basically he is having, after the running session in the morning, he go to the home, and after having his lunch, he has have a afternoon snap. And when he wake up from his bed, he found that he was having the restricted range of motion, or restricted. He is unable to flex the knee, unable to flex his lower limb, and having a severe pain at this particular area, which is a quadricep tendon. So here I am actually doing the facial release, myofascial release for the femoris bicep muscle and other quadricep muscles. So you can see the movement. You can see now. You can see that the range of motion has increased. The pain he is telling about reduced. As we are already late to finish it up early, I have muted the voice of the video. But in that particular thing, he is. You can see that the range of motion has increased, and the pain is now reduced. Now you can see that I am going slight more deeper. You can see the movement above my finger, the movement of the muscles, the movement of the fascia. If you will minorly observe in this particular area, now you can see that the range of motion is far more increased, and he is telling that now the pain is around 5 out of 10. The range of motion has considerably increased. Now I am going to do the joint manipulation. You can see that I am going to break it. I am into the physiological barrier, and I am going to articulate it, or I am going to manipulate it. So I will just. So you may have listened the thrust I have given. Now I am adjusting it at the micro level. At the macro level, I have done the manipulation, and now I am doing the mobilization. So this is basically the mobilization, and you can see now that the range of motion has increased, and also the active movement has been increased. Still, there is a some sort of pain is remaining. You can see that with the passive with mild force, the patient is able to completely flex the knee. Now I will go some more deeper fascia. If you have seen, I have gone step by step from superficial, medial, and now I will go more deep fascia. So you are going to see more clear muscle movement, facial movement above my finger. I am just finding, palpating the where is a nodule or where there is a facial restriction or distortion is there. In the European facial distortion model, this is called as a trigger band. I am treating basically a trigger band. Now you can see that he is more comfortable. So this was the myofascial release. You have seen the efficacy of the myofascial release. Then these are the examples of the ISTM with both the tools. Here in the first video, you can see that I am doing the myofascial release with this particular instrument for the smaller region. I am just releasing the Achilles tendon and the tibiotalar ligament. In this particular, I am doing the soft tissue mobilization with this bar for the hamstring and the quadricep for the quadricep tendinosis. With the help of this bar, I am doing the soft tissue mobilization. This kind of soft tissue mobilization is also helpful in the osteoarthritis also, because most of the time in osteoarthritis, except the particular that degeneration, because of the degeneration in the knee joint, the quadricep tendons, the tibial tendons, the all other tendons which are attached to the knee got fatigued because of the extra pressure on them. And with this kind of soft tissue mobilization, you can give the instant relief in osteoarthritis. A chronic condition like osteoarthritis also, you can give the instant results. Okay. Then this is the cupping method. So in this first video, we will see the dynamic cupping or the cupping with the movement. So for the shoulder pain patient, we have attached the cup and ask the patient to do the as much movement as he can do. So because of this movement, what is happening? The fascia is getting released. The pressure over the tendons and ligaments of these shoulder joints are getting reduced. Here you can see that we have attached it till the infraspinatus muscles. Also all the supraspinatus, deltoid, pectoris muscles, so that all the muscles which are helping the movement of the shoulder joints can be released. The myofascia and the soft tissues around the shoulder can be released. In this particular video, we can see the weight cupping to reduce the visceral load, the lymphatic load, and also as per Ayurveda point of view, as the patient was having the chimchimayan at that particular, so it was the raktagat vata lakshana. So for that purpose, we are doing the raktamokshana with Alabu method, or in modern day it is also called as a weight cupping. Then in this particular video also you can see the dynamic cupping for the hamstring stage. You can see that I have attached the cup around all the hamstring muscles, all the 4 hamstring muscles, and now giving him the stretch. So that is going to help release the myofascia, the deep tissues, deep fascia, superficial fascia. So this was all. These all are the examples of the soft tissue mobilization. So if there are some queries around this, the queries are welcome. One more thing I have to announce here. One more thing we are going to share with you. Just a minute, Kiran Soni ma'am. Please be there. I'm just having one declaration. After that, I will take your question definitely. Dr. Kiran Soni sir or ma'am, because it's very confusing the name like Shital and Kiran, because they are both the genders. Just a minute. Okay. So friends, we are having a master class in Ayurvedic orthopedics, where we are going to learn all these techniques in very depth, in very precise manner of understanding, that will help you in treating more than 70% of the 70 to 80% of the conditions which you have not treated earlier, or which you have treated, or in which you have got the difficulties in treating. So most of these cases are going to be covered in this particular masterclass. It is a 6-month comprehensive orthopedic course for the Ayurveda doctors. So in this particular thing, we are going to see the functional anatomy, diagnosis, and all the three kinds of diagnosis, that clinical, radiological, and pathological. The Marma chikitsa, Bandha chikitsa, in which bandaging, therapeutic taping, the modern taping, the ancient Ayurveda bandaging techniques we are going to see. The Agni Karma and Vedan Karma also we are going to discuss. The cupping, all three types of cuppings, that is dry, wet, and dynamic cupping, along with the fire cupping. Also, I am going to share with the knowledge the innovative panchakarmas like laser janubasti or laser katibasti, or the traction janubasti, traction katibasti. Also, postural correction. The postural correction is a USP of my practice. It will give you a tremendous support and help in your practice in releasing the musculoskeletal, all kinds of musculoskeletal pains. The postural correction program, you can be a postural correction expert in your area. Also, the myofascial release, as we have seen today, the 𝐵𝐴𝐴 dry needling, the superficial, and 𝐵𝐴𝐴 we are going to see the dry needling. How the dry needling? Because as you know that the Vedan Karma is just a skin deep manure, but in Gambhir Vedan Karma you will be able to do the deep tissue dry needling, like the muscle needling, the tendon needling, the ligament needling you are going to learn. Then also trigger point therapy, just we have seen. The posture correction has been repeated here, sorry. Then the osteopathic articulation of the spine and joint we are going to see in that particular knee patient, that athlete. I have shown you that articulation of the joint. So we are also going to see the articulation of the spines also. The instrument assisted soft tissue mobilization is completely what we can say that organ by organ, side by side, we are going to learn the instrument assisted soft tissue mobilization, and also the muscle energy techniques for all the joints and spine we are going to cover in this course. And how is this course is going to be conducted? So this course is going to be conducted module wise. There are total 12 modules. In the first module we are going to see the basic understanding of the anatomy, the basic understanding of the sapta dhatu which are in Ayurveda, also the kala kaliya which are of the Ayurveda. Then the functional anatomy of the spine and joints we are going to see, that how, because for the soft tissue mobilization and for the manual therapy you must have a very proficient knowledge about the spine and joints, their mobility, their orthokinematics, that I have said. In the module 2 we are going to see the what is the pain, how the pain mechanism happens in our body, how a patient pursues the pain, and how the body reacts to the pain. Then the classification of the pains which is going to help us in our practice. Then the Vat Rog Samanya Vishay Chikitsa, that Chikitsa Siddhant, which we are going to elaborate, and which we are going to correlate and synchronize with the modern way of pain management. Then in the module 3, we are going to see the clinical diagnosis, the postural analysis, radiological analysis, and the pathological analysis. All each lecture, each module will have at least 4 to 5 lectures, each topic I am showing you all the topics which we are going to cover in our course. And at the fourth module we are going to see the panchakarma, that how should we set the protocols for the panchakarma. ऐसा नहीं है कि सर मैंने पहले अग्निकर्म करके देख लिया, फिर जादूबस्ती करके देख लिया, फिर उसको स्वेदन करके देख लिया, फिर षष्टिक्षाली किया, फिर उससे भी फर्क नहीं पड़ा तो फिर अग्निकर्म कर लिया, फिर रक्तमोक्षण. No, we are going to learn how to set the specific panchakarma of the protocols. We are not anymore going to experiment with the patient. Then regular उपकर्मस कैसे यूज करना है, जो हम कटी बस्ती जानू बस्ती करते हैं, उनको कैसे यूज करना है. मॉडिफाइड उपकर्म, जैसे मैंने अभी कहा कि हाउ वी कैन यूज द टेक्नोलॉजी अलॉन्ग विद, जैसे ISTF के साथ अगर आप जानू बस्ती करते हैं तो देन इट इज गोइंग टू गिव एक्सेलेंट रिजल्ट. देन अग्निकर्म, वेदन कर्म, हम गंभीर और उत्तान दोनों सीखेंगे. वेदन कर्म जैसे कि मैंने पहले भी बताया. इन फिफ्थ मॉडल वी आर गोइंग टू सी दी अदर पैरासर्जिकल सेमी पैरासर्जिकल cases like the cupping, dry weight and dynamic bandha lepan, then kinesiology taping, also the myofascial release. In the module 6 we are going to see the manual therapy, particularly into the trigger point, Marma chikitsa, osteopathic articulation and soft tissue mobilization, that is the STM. And after the seventh module we are going to see one by one, that is like cervical spine, the thoracic spine, the lumbar spine, their diagnosis, their diseases, their clinical, radiological and pathological diagnosis, then the treatment part there and the rehabilitation part. All this, so the each module, each chapter, for example, the cervical spine is having a 3 lectures, differently 3 lectures for each type, then for the thoracic spine, then for the lumbar spine. And also we have covered pelvic girdle because it is going to be a very important topic for the female participants. It is going to be very important for the post-delivery, post-labor patient, the pelvic girdle, because the pelvic floor exercises, pelvic floor dysfunctioning are one of the major cause in the females for the low back pain and the spondylitic or the arthritic conditions. From the 8th module, we are going the joint by joint, the upper body joints like shoulder, elbow, and wrist joint. In module 9, we are going to see the lower body joints like hip, knee, and ankle joint. In the 10th module, we are going to see some of the physiological diseases in the rheumatism category, like RA, the post-streptococcal arthralgia, post-rheumatic arthralgia, post-viral arthralgia, then the ASO positive, then other kind of rheumatism like SLE, or the rheumatism because of the CA or the Amaj Samprapti. Basically, we are going to cover in this particular rheumatism topic. In ankylosis, we are going to see some of the physiological diseases which affect the anatomy of the joints. That is ankylosis, the diagnosis of these particular through modern and Ayurveda. Also their treatment, the medicinal treatment, the physical treatment. We are also going to cover all the medicinal parts. Also we are going to see the physiological and anatomical corrections of the orthopedic conditions. Then in this special module, we are going to discuss the special conditions and syndromes. There is a long list of these, like the for example, there are the different kind of arthralgia. There are different kind of arthralgia due to the anemia, arthralgia due to the ankylosing spondylosis, then the Osgood-Schlatter disease, some rheumatic diseases, rheumatic pain. We are going to discuss in this particular topic, and at the last, in the 12th topic, we are going to cover the diet and nutrition, and also yoga and muscle energy techniques for the rehab purpose. So if you do all this, this is me who is going to pilot this course, Dr. Swapnil Gawande. And all these techniques I have learned from all these worldwide best teachers, right, from the USA to Japan. Yeah, I can say that I have learned all these techniques from the east to west. The first country where the sunrise happens, here you can see my picture with Dr. Jay Amata from the Osaka College of Osteopathy. And I'm also pursuing from the same college the next degree, the diploma in chiropractic manipulative practice. which is a 4-year long course. Now I am in the 3rd year. Then from the middle of the world, Mr. 𝐒𝐎𝐅𝐄, the 𴑍𝐈𝐒 from Canada, our own the Marma chikitsa from Dr. 𴛏𴏆 the great legend who is now not with us, Dr. Arshad. I have learned from the sports medicine in Ayurveda from him, and Dr. Kostopoulos and Rizopoulos, where I pursued my mastery certification in manual therapy, and Dr. Thurston Fisher, where I learned the facial distortion model or the deep tissue or the soft tissue mobilization. So this I am extracting all this knowledge in this single course. So if you go for one by one, so this will cost approximately more than 2 lakh from the Indian teachers. If you go through all, because I have spent more than 20 lakh rupees in last 7 years to earn all this knowledge, and I am sharing it this with only rupees 20,000, because at IIS and Arvachin Ayurveda Gurukul, we have the vision to empower our Ayurveda practitioners, Ayurveda doctors to be the specialist. So this is the last lecture. This is the last day of the 20th June that we are offering a special discount, because there are very few seats. I think there are only 7-8 seats are remaining for the special discount of 50. We have declared in our first course that for the first 50 people we are having, because these are the action takers. Most of you are thinking that करना चाहिए कि नहीं करना चाहिए, 15,000 वेस्ट चला जाएगा, क्या हम ऑनलाइन करके ये सब सीख सकेंगे, क्या हमें प्रैक्टिस में मुझे इसकी जरूरत है. All these thinkings are going to end here. All this is going to end here, because I am going to give you all the nectar of my knowledge I have acquired since last 7-8 years from all the great teachers. And now if you register within 48 hours up to tomorrow night, then you can book it into the installment also. You can pay only 3,000 and you can book your seat and rest. You can pay before the course started. So, and one more thing here, we are going to declare for these action takers, because these are the people who are going to change the future of Ayurveda, which are going to change the vision of the world looking towards the Ayurveda. So we are offering absolutely free 2 days hands-on offline workshop worth rupees 15,000, absolutely free with food. Accommodation, we are planning, if it is possible, if you are okay with the accommodation we will provide, then it's okay, or you can arrange it of your own, but it is going to be for only first 50 admissions, because we can't accommodate or we can't spare this much of money. So you are not going to lose anything. You are not going to lose a single penny. You are not getting this 6-line online course, but you are also getting a 2 days residential offline workshop where you can have an opportunity to practice offline, where you will have an opportunity to ask your queries directly to me, where we can directly discuss your queries. Your proficiency will be maintained, hands-on training will be provided to you. So this is all from my side. So for the payment, this is the bank details on your screen. You can contact Dr. Manjusha and Dr. Lalit for the same. If Dr. Lalit sir or Manjusha madam are there, please put your contact numbers and details into the chat box, because I am here. Stop sharing. So yes, Dr. Lalit is here. Hello, Lalit sir. Hello.
हाँ सर.
तुम्ही बोलू
हाँ
शकता.
सर, कंटिन्यू.
Okay, so if you have any query regarding both the things, today's topic, I think Dr. Kiran had asked some question. So Dr. Kiran, if you are there, you can raise your hand again. हाँ डॉक्टर सर, ललित सर. ललित सर,
हाँ सर.
तुम्हाला बोलायचं आहे की बोलू शकता? तुम्हाला बोलायचं आहे काही बोलू शकता म्हटलं तुम्ही. ललित सर, तुम्हाला बोलायचं आहे काही बोलू शकता म्हटलं. I think it is. Okay, are there any questions? Are there any queries regarding the manual therapy, or you have regarding the course? Both are welcome. You can either put your query into the chat box, or you can also directly raise your hand.
कोर्स रिगार्डिंग अगर आपकी कुछ क्वेरीज है तो मुझे और मंजूषा मैडम को, मेरा नंबर मैंने चैट बॉक्स में डाला है, आप कॉल कर सकते हैं. और आज के टॉपिक रिगार्डिंग अगर आपकी कुछ क्वेरीज है तो आप हैंड रेज करके या चैट बॉक्स में मैसेज डाल के सर को क्वेश्चंस पूछ सकते हैं, या कोर्स के रिगार्डिंग भी कुछ आपकी डिफिकल्टी अकॉर्डिंग टू सिलेबस और बाकी चीज, तो वो भी आप सर को पूछ सकते हो.
So if there are no queries or no question, should we conclude? If there are no queries or there are no questions, we will. Should we conclude?
सर, चैट बॉक्स में एक क्वेरी है.
नहीं दिखत तो नहीं.
While performing chiropractic, any kind of complication may occur.
Yeah, there are. They may occur. एक minute. Hit chart. Okay. एक minute. I think that now. Sorry, the chat was closed from my side. Now you can put, or Lalit sir, if there are the chat box queries, please repost in the chat box. Chiropractic, there is, if you are not going to perform it correctly, it is definitely going to make a big harm. There are the cases we have seen that patient have broken the spinous processes. The patient had the non-qualified people have broken the rib fractures are there. The spinous process fractures are there. The disabilities are there. In this particular course, we are not going to cover the chiropractic, but yes, definitely those 50 people who are joining in the first in the hands-on therapy, we are going to definitely teach or share some of the knowledge about the chiropractic, because chiropractic is the thing which is going to be teach practically. Yeah, the theory and the philosophy of the chiropractic we are going to share in this particular topic, in this particular course. Any queries are there? Oh. Okay then, goodbye, see you soon.